Good morning to everyone. I'm Kim Ann Win, President and CEO of Blood Bank of Hawaii, and it's great to hear and see all of you. And today is a wonderful day. Even though I want to open up with some numbers, it's April the 29th today. And unfortunately, at the end of April, the world has now seen over 3 million cases now of COVID-19. And I think today we are at over 200,000 deaths. Just in the United States, our country alone, today we are at over 1 million cases of infected patients and many, many tens of thousands of deaths. In the state of Hawaii, as you all know, we are at over 600 cases and 16 deaths. And even though it's only been, 4 or 5 months since the world first saw this disease, today at 3 million cases, there are still no real answers, no vaccines, and no FDA-approved treatments. But today, Blood Bank of Hawaii is happy to report that we are going to be doing something positive for the state of Hawaii for the patients who have COVID-19 infections. And that is why we are convening this media event today. So I'm very happy to report that Monday of this week, April 27th, Blood Bank of Hawaii collected the first COVID-19 convalescent plasma in entering into a coalition to collect convalescent plasma for the experimental treatment of COVID-19 infected patients. This is a historic moment for the state of Hawaii. And this is not a historic moment for Blood Bank of Hawaii. This is a historic moment for our state. And Blood Bank of Hawaii does not go into this alone. The innovative and historic aspect of this program, this COVID convalescent plasma program, is that we formed a statewide coalition. I call it informally the Hawaii CCP, the Hawaii Convalescent Plasma Coalition. And that's what we are announcing today. And so with me are some key members of the Hawaii Coalition for convalescent plasma, and I'm proud and honored to stand among all of them to announce this historic event. So first, you may ask, what is CCP? What is COVID-19 convalescent plasma? So let me take a step back. So first of all, COVID-19, as you've been seeing in the news, takes a terrible toll. Although many patients who are infected with COVID-19 may not know they're infected. So 50, sometimes up to 80% of patients who are infected show no symptoms at all, or maybe what we call subclinical, meaning may not know they're infected. Then another group of patients who are infected may have some symptoms, mild or maybe even moderate symptoms. The next group of patients have moderate or severe infection symptoms, and those patients have to go into the hospital. Once hospitalized, now the mortality and morbidity can be quite high. And the next group of patients, once they're severely and critically ill, now that they go on a ventilator, and you may hear that the number of patients who go on a ventilator, upwards of 50%, and in some regions, 80 or 90% of patients who go on a ventilator unfortunately, never come off the ventilator. And so patients who are severely and critically ill need to have therapies that can help take them from critically ill off the ventilator and severely ill out of the hospital. And these are the patients that we need to look for therapeutics. And so you may have heard in the media of experimental protocols. And convalescent plasma has been known and tried for almost 100 years as an option very early, before other options, more specific options like pill, injectable medications. And it has worked in the early stages before we have better options. So, what is convalescent plasma? So convalescent plasma is plasma taken from individuals who have been infected with bacteria or viruses, and fortunately who have recovered. So these are people who have either gotten subclinical, meaning the first group of patients we talked about never knew they were infected, mild infections, or even moderate to severe infections, but they made the road to recovery. We believe that they've recovered because their immune system has developed antibodies or cells, immune cells, that have been able to eliminate and fight off the virus or bacteria. So it's thought that taking plasma from these recovered individuals can transfer these neutralizing antibodies to patients who are severely or critically ill, before their bodies have the ability to build up enough of these neutralizing antibodies. This convalescent plasma and the transfusion of the convalescent plasma has been shown to work in other illnesses before we can make other therapies. And so that's why we're trying it now for COVID-19. It's experimental, it's early, and it's a bridge treatment. Is it a miracle? Is it a panacea? We don't believe it. But this is what we have. So that's why we're doing it in Hawaii. So what's new and what's different about the Hawaii Coalition? What's new and what's different is that in order to make this available to as many patients as possible, we've asked all of the hospitals of Hawaii to come together and join in a national protocol so that all of the hospitals in Hawaii would register into this protocol. And once on this protocol, the Blood Bank of Hawaii would then be able to collect the plasma and to provide it to all of the patients at all of the hospitals. So that's the first thing. The second thing is that we need to identify potential donors. Who are these donors? The best way to identify donors is to find patients who have already recovered. And so we are partnering with the hospitals and the physicians and the Department of Health, because the physicians and the DOH already know who the recovered patients are. And so DOH and all of the physicians in this coalition have agreed to help Blood Bank of Hawaii recruit these recovered patients. And so we don't have to go out to the community, although we're doing that too, but it's best if these recovered patients can be pre-screened and come to us through our partners. And then finally, and hopefully we'll hear more from our partners, in the beginning, there may not be enough of a supply of CCP for the patients in our hospitals. So it'll be important to prioritize which patients should be listed and which patients may actually derive the greatest benefit and which patients might be at greatest risk. And so who should be the individuals or the physicians who should make the decisions on the prioritization as well as the risk basis? And Blood Bank of Hawaii believes that it should be a coalition or a group of physicians. And so for all of these reasons, we believe that a partnership and a collaboration where there's transparency and a true partnership is the best way for Hawaii. And so I just want to report that in fewer than 2 weeks, the coalition was formed on April 15th, and on April 27th, less than 2 weeks later, we did our first collection. So in times like this, it is amazing what a group of committed and smart institutions and individuals can do. So I'm going to stop talking now and introduce some members of the Hawaii Coalition. So I'm going to turn it over next to Dr. Tarquin Collis at Kaiser Permanente to speak about Kaiser and his role in the coalition.
Hello, everybody. Yes, happy to be up here representing Kaiser as part of the coalition, along with the Blood Bank of Hawaii and other organizations here under the umbrella of really a Mayo Clinic study that we're all grateful to be a part of. I'm an infectious disease doctor by training. I spent most of my adult life trying to sort out and combat infections of various sorts. And I will say this, SARS-CoV-2 is a very worthy adversary. This is a very tricky virus. Our team at Kaiser diagnosed the first 2 cases in the state. I was on call that weekend. I remember it very well. And I will tell you, it's very frustrating to have someone in front of you who's very ill, acutely ill, and to know what they have, and yet not to have any tools in your toolbox to offer them other than excellent supportive care. And I think we all hope that convalescent plasma may have a place in that toolbox. And I think this study will go a long way to help us sort out when we should use it and how best to really get patients to a better place for whom this is a very serious infection at times. I think as an organization, Kaiser has some neat things to offer, and I'm happy to bring those here along with the other organizations here. It's nice to be part of an integrated medical system with a really excellent medical record. We have an active list of all the patients in our system who have recovered from COVID-19. I've been involved in the care of many of those folks, and almost to a person, they have asked, how can they help? Typical Hawaii, right? How can they help contribute? And I think this project offers them a chance to really do that, to literally help give blood in an effort to help other folks who are struggling with an infection that can be quite deadly. I'm an optimist by nature. I know that SARS-CoV-2 has turned the world quite upside down and has been a tragedy for many families. But there have been some good things to come of it, and I think that what you see here is one of those. It's neat to have big organizations that aren't used to playing in a sandbox together, coming together for a really important good, and humble and grateful to be a part of that. So I'll stop there. Thank you.
Good morning, Dr. Douglas Kwok. I am a pediatrician and pediatric infectious disease specialist by training. I'm the Chief Medical Officer at Palimomi Medical Center, and I'm Hawaii Pacific Health's representative on this coalition. Hawaii Pacific Health is a hospital network consisting of 4 hospitals: Wilcox Medical Center on Kauai, Straub Medical Center, Palimomi Medical Center, and Kapiolani Medical Center for Women's and Children here on Oahu. All 4 of our facilities are registered and credentialed with the national study that this coalition is participating in. We have principal investigators that are also registered in the study as well too at all of our facilities, so we do stand ready to provide plasma to those that qualify or in need. We are also working with Dr. Nguyen's Blood Bank of Hawaii team to help identify individuals that might serve as eligible and appropriate donors. This coalition has turned our community upside down, and it's affected our community in a great way, and we can't fight this infection individually. We need to fight it as a community, and that's why Hawaii Pacific Health is proud to be represented and participating in this coalition with our community partners in this, and we are looking to see how we can explore COVID convalescent plasma as another hopeful treatment in our fight against COVID-19. Thank you very much.
Good morning. My name is Dr. Ana Ortega-Lopez, and it's a pleasure to be here representing the Queens Health Systems. I'm a transfusion physician, a transfusion medicine physician by training, and I'm the laboratory director for the Queens Medical Center. And I come here to say that we're very excited and very happy to be able to support these wonderful project. And we're also very proud to be able to team up with all the different health systems in the islands and be here today and share this podium and with our colleagues at the Blood Bank of Hawaii, which I want to acknowledge because as a blood banker, I know how much work it is to set a project like this up in 2 weeks. And also, not just today, but Blood Bank of Hawaii supports us daily, every day. They're able to give us all the blood products that we need for our patients. And I think they're always in the background there helping us, so I want to make sure that we acknowledge them today as well. So we're very excited because having these convalescent plasma available, not just for now, we can give it to the patients that we have now in the hospital that could benefit from it, but it's also exciting that we can keep collecting plasma and we can keep it for many months frozen, available if COVID-19 becomes a problem in the near future, in the fall, in the winter months. And I think that's very exciting because we can collect data, we can gather experience and learn some more. And also, as our colleagues were saying, this also brings some light to the moment. We've all had really dark a few months lately, and I think it brings some hope and some color to the picture. And it's an excellent opportunity for all of us in the medical field to be cooperating together. Not only the health systems that are a medical school giving us support, all the hospitals are participating in the same clinical trial where there's definite criteria of which patients may benefit from convalescent plasma. And I would also like to acknowledge my colleague, Dr. Todd Cito at the Queens Medical Center, who's the principal investigator of the clinical trial there. And he was one of the initiators of this movement, of this coalition, and he's working very hard for it. And I think that's all I have to say today, but probably the last comment is to please, I want to encourage everybody that has passed the disease to come forward and donate for the community, since one collection can benefit 4 people and you can donate multiple times. So please come and help us all fight this disease. Thank you.
I want to conclude by, again, thank you all of the Hawaii Coalition members. This is not the end of the coalition. This is just the beginning. And for Blood Bank of Hawaii, while we're happy and proud to announce convalescent plasma, for us, the important thing is the formation of a coalition. We will be living with COVID-19 far, far beyond the summer, is my prediction. And we will be needing this coalition and many other coalitions for this state and for the healthcare environment to take us into the rest of COVID-19 and beyond. And so it's my hope that this coalition will be just the start of how we function together as a team in solidarity moving forward. Thank you.